I'm Casey Eichelberger. I'm chair of the Department of Obstetrics and Gynecology, and I'm a practicing maternal fetal medicine physician. So we are always left with a conundrum with pregnant women of having to use our best scientific rationale to decide if it's safe to proceed with vaccination or with medication, in this case vaccination. The American College of OBGYN, ACOG, recommends strongly that pregnant women be offered active vaccination right now. The Society for Maternal Fetal Medicine similarly strongly endorses access for pregnant and lactating women. And recently, the Academy of Breastfeeding Medicine added their support that lactating women should be included as general population in vaccine rollouts. So all of the major societies do endorse access for pregnant women. The vaccine has not been intentionally tested on pregnant or lactating women. That said, that is not unusual. Most of the medications and vaccines we use in pregnancy were never initially tested on pregnant women, so this is not unusual for those of us who practice obstetrics and gynecology. Also, the Moderna vaccine, on December 4th, Moderna submitted to the FDA the results of what's called a DART analysis, so developmental and reproductive toxicology report, meaning pregnant lab mice who were exposed to the medication, and there were no adverse outcomes in that study. So that is further evidence from the lab that would suggest safety. There's also a biologic plausibility argument here, which is that the vaccines, the mechanism of action, should make them very safe in pregnancy. So there's nothing about the mRNA technology that makes us nervous in the medical community for pregnant women to receive the vaccination. Vaccination is actually a really common practice in pregnancy and something that we encourage actively. So most pregnant women or women who have been pregnant are very familiar with getting the injectable flu vaccine as well as the Tdap vaccine to prevent against pertussis or whooping cough. These are vaccines that are incredibly safe, and if you do receive the COVID vaccine, you can still receive your flu and Tdap vaccine. We just ask that you wait 14 days after your COVID vaccination before your next vaccine. Similarly, one other question we've gotten has been RhoGAM injections, which is an injection for women who are Rh negative, and there is no reason to delay your RhoGAM injection at all if you've recently received the COVID vaccine, so that's completely compatible. We have seen a big uptake in our own department of people who are either pregnant or recently postpartum and lactating who've accepted vaccination, including many of our midwifery colleagues, which has been fun to see. Many of us have the feeling right now that we're just extremely grateful for the science that has led to a vaccine, and we're delighted to be as close to the front of the line as we can be to access it. Interestingly, on social media, there has been an outpouring of postings of pregnant physicians and nurses who have gotten the vaccinations. They've been posting online on Twitter with the hashtag #MySMFM pictures of their big pregnant bellies and the needle going in their arms. So that's been really fun to see from a public health campaign perspective. The CDC website has a ton of good information. ACOG.org and SMFM.org also do. And then your women's health professional, so your OBGYN, your midwife, whomever the person is that you turn to for expertise in the clinical area, they will be equipped as well to help you triage that question. We support the decision of any pregnant or lactating woman to make decisions for her own body about what feels safe. Our job as OBGYNs is to equip them with the best evidence that we have to help them make choices that feel right for them and for their family. I would certainly feel comfortable encouraging women that the data we have now appears highly safe. If the question is personally, if I were pregnant or breastfeeding, would I take the vaccine right now? Absolutely, 100% I would.